We begin with circumcision.
The caregiver will place a device over the glands.
The external genital organs are concerned in both reproduction and with the elimination of waste, that is urine, from the body. These external genital organs are close to the anus, and therefore proper care must be given to these organs. In males, the opening of the urethra at the end of the penis is covered by the foreskin or prepuce. This must be removed by a simple operation called circumcision, which simply means cutting around. What are we cutting around? We are cutting around the glands of the penis to remove the foreskin. Will the boy die if not circumcised? No. However, there are lots of benefits or advantages when a boy is circumcised. Some of them are: 1. It prevents microorganisms or germs from hiding in the foreskin and causing infection, which could damage the penis. 2. The removal of the foreskin also prevents the accumulation of a yellowish secretion produced by gland cells around the end of the penis. If the secretion accumulates and not cleaned from the tip of the penis, it could cause cancer of the penis. Finally, the foreskin may become abnormally red or swollen, causing pain during urination in young boys. It must be stated clearly that a boy can live a normal life without circumcision. Therefore, if care is not taken, circumcision, which is supposed to benefit an individual, will become injurious or a disadvantage to the person. Let us look at some disadvantages of circumcision when not properly done in boys. It may lead to excessive bleeding from the wound. If proper care is not taken after circumcision, the wound may become infected by germs. Circumcision may lead to transmission of diseases such as AIDS, or even death of the child if the blade and other instruments used for performing the operation are not properly sterilized. Circumcision in females is practiced by some tribes or ethnic groups. An uncircumcised girl is not considered as normal or marriageable. She is abused, ridiculed, and called all kinds of names. Tribes and ethnic groups that practice female circumcision remove the clitoris and parts of the vaginal lips. Their reason for this practice have unfortunately no scientific basis. Therefore, this practice is purely done on beliefs and superstitions. Some of these beliefs, for example, are: 1. That the removal of the clitoris provides enough space for dilation of the vagina during labor. 2. That the absence of the clitoris will enable the penis to penetrate the vagina during sexual intercourse without obstruction. 3. That the removal of the clitoris will allow free flow of urine. How? They say, since the clitoris is above the urethra, it may obstruct the free outflow of urine, and therefore it must be removed. Most of the disadvantages in male circumcision are applicable to female circumcision. However, there are few additions to what have been stated already. Some of these additions are: 1. It makes the girl in her adult years not sexually responsive. This attitude may create problems between her and the husband. Finally, the removal of the clitoris and other parts of the vaginal lips often make childbirth or labor difficult due to the scar formed around that region.